Welcome to UMCC Medical Consultant Connectors, where your health matters to us. What is thrombocytosis? Thrombocytosis is a condition where your body produces too many platelets, which are essential components of your blood. Platelets are tiny blood cells that help your blood clot, playing a crucial role in wound healing. We need platelets to stop bleeding when we get a cut, as they gather at the site of injury to form a clot. However, having too many platelets can be a problem, leading to potential health issues. They can clump together and form dangerous blood clots, which can obstruct blood flow. Think of it like this. Imagine your blood vessels are like highways, and platelets are like tiny cars. Platelets are like tiny cars that rush to the site of an accident, a cut, to help repair the damage. In thrombocytosis, there are too many cars on the highway, increasing the risk of a traffic jam, which is akin to a blood clot. These clots can block blood flow to vital organs like the heart, brain, or lungs, leading to serious complications like heart attack, stroke, or pulmonary embolism, which can be life-threatening. It's essential to understand thrombocytosis, its causes, symptoms, and treatment to manage the condition effectively and minimize potential risks, ensuring better health outcomes. Causes of high platelet count. There are two main types of thrombocytosis, primary and secondary. Primary thrombocytosis, also known as essential thrombocythemia, ET, is a rare blood disorder where your bone marrow makes too many platelets, leading to an increased risk of clotting. The exact cause of ET is unknown, but it's thought to be linked to genetic mutations, which can affect the regulation of platelet production. Secondary thrombocytosis is much more common and occurs more frequently. It happens as a reaction to another underlying condition, such as infection, iron deficiency, or chronic inflammation. Inflammatory diseases like rheumatoid arthritis can also lead to secondary thrombocytosis. Certain cancers, major surgeries, or physical trauma can also trigger an elevated platelet count. Identifying the underlying cause is crucial for effective treatment, as it helps in tailoring the appropriate medical intervention. Recognizing the symptoms. Many people with thrombocytosis don't have any symptoms. It's often discovered during routine blood tests. However, when symptoms do occur, they can include headaches, dizziness, vision changes, numbness or tingling in hands and feet, chest pain, shortness of breath. These symptoms can also be signs of other conditions. If you experience any of these, it's important to see your doctor for a proper diagnosis. Diagnosing thrombocytosis typically involves a few key steps. First, a physical exam where your doctor will ask about your medical history and symptoms. Then, blood tests. A complete blood count, or CBC, measures the number of red blood cells, white blood cells, and platelets in your blood. A high platelet count may indicate thrombocytosis. In some cases, your doctor may recommend a bone marrow aspiration and biopsy to examine the cells in your bone marrow and rule out other blood disorders. Treatment for thrombocytosis really depends on the cause and severity of the condition. It's crucial to identify whether it's primary or secondary thrombocytosis to determine the appropriate course of action. For secondary thrombocytosis, treating the underlying condition often resolves the high platelet count. This means addressing the root cause, which could be an infection, inflammation, or another medical issue. For example, if an infection is causing the high platelet count, treating the infection with antibiotics should bring the count down. It's important to follow the prescribed treatment plan to ensure the infection is fully eradicated. For primary thrombocytosis, treatment aims to reduce the risk of blood clots. This is because high platelet counts can lead to serious complications like strokes or heart attacks. Options include medications. Your doctor may prescribe medications to lower your platelet count, such as hydroxyurea or interferon alpha. These medications help to control the production of platelets in your bone marrow. Another option is platelet pheresis, a procedure that involves removing platelets from your blood. This can quickly reduce platelet levels in critical situations. It's usually reserved for emergencies when there's a high risk of clotting. This procedure is often used in conjunction with other treatments to stabilize the patient. Prevention of secondary thrombocytosis focuses on managing underlying conditions. Regular checkups and monitoring can help catch issues early before they escalate. This includes promptly treating infections, ensuring that any inflammation or other medical conditions are kept under control. Maintaining a healthy lifestyle with a balanced diet and regular exercise, and quitting smoking are all crucial steps. These habits can improve overall health and reduce the risk of complications. While primary thrombocytosis isn't always preventable, understanding your risk factors and discussing them with your doctor can help with early detection and management. Regular screenings and being aware of family history are important. Remember, while thrombocytosis can be a serious condition with proper diagnosis, treatment, and monitoring, most people can live normal, healthy lives. Staying informed and proactive about your health is key. UMCC, your ultimate medical consultant connectors.